So interesting to hear from everyone. Thank you so much for sharing your perspectives. As I said at the top, we're coming from Wellcome Trust, and so we're a philanthropic funder, but we sit more at the science, academia end, obviously related to healthcare, so we maybe think more about discovery research, fundamental science behind some health issues, but kind of go into products as well. So I think we've not done a whole lot more at the kind of coalface with health interventions, things in countries so much, but we're starting to think about, obviously we connect into it, and we're starting to think about with our new strategy how we can have more impact on the ground. And so I think it's just in the first place really, really helpful for us to listen into these discussions, hear about the things that you're doing and what's working and the things you've learned. So I've just written down a few thoughts from the perspective of a funder, maybe a funder who's not so involved in some of these things right now, which may or may not be interesting to try and reflect in your roadmap. So I'll try and make sense of the things I've written down. Maybe the first thing from, say, a funding perspective is, and how we can kind of come in and support what you're doing is kind of making the case for what you need from us and how we can contribute to the great programs you already have. I think we're very conscious sitting in London that, you know, the people on the ground are the experts. They know what is needed and how to run things. We can obviously bring the financing. There's other aspects we can bring, but it's sort of being clear what you need from the funders. And I think we're trying to do more in terms of long-term financing, which sounds like an interesting thing that people are talking about as being helpful. I suppose as well from our perspective, sitting more at the research end, how we can kind of work down this chain from more the research background science, creating the products into sort of using them on the ground, because this is something we tried to work on, but I don't know how much connectivity there is. We're very clear that when we are working on something where we're developing a product, we have to be thinking about that it's useful for the users, that it has access built in from the start, but actually, you know, do we have the expertise to make that happen? Who do we need to speak to further down the line? I think you were talking about, you know, midwives, the scanning equipment not being appropriate for them. And, you know, if we've created this technology, how can we make sure that it goes all the way down the line? So maybe there's a connectivity piece where kind of different funders with different perspectives can support. It's really interesting to hear about the sustainability question as well, because I don't think we've cracked that. It feels like a really hard thing to do. And when we're funding, we think a lot about building capacity and capability that can stay in country. But obviously, like our grants last a certain length of time. Like you were saying, the money runs out eventually, and then you need somebody to step in and keep it going. And something that we work on a lot, which it sounds like you all are as well, is thinking about partnerships and bringing in new people, new perspectives at different points who can kind of keep things going. And so some of our projects, that's the tactic we use. For example, we have an AMR surveillance program that we're running in, I think it's Kenya, Malawi, and I've forgotten the last country. Kenya, Malawi, and Ghana, which is in partnership with Pfizer, but we're making sure it's in partnership with the governments of those countries as we go to make sure that, you know, they're able to pick this up when we sort of start to exit the space. And my last point that I was thinking through was, as a funder as well, we try and bring our expertise and our help when we're working with partners on projects. So is there anything else that you could get from us in working with us on this sort of thing? So we work a lot, say, on trying to help create an enabling environment for research to be used, this connectivity. We also work on advocacy. We have some connections. So I don't know if there's something that you talk a lot about different foundations that you're already working with. What are they bringing to the table? Is there more that you can get from them? Is there more that we can be doing as partners in these projects, more than just, you know, supplying the financing for it? So that was an eclectic list of things that I've been noting down as we've been going. It's been really interesting. I think we're learning a huge amount, but yeah, maybe in your roadmap, thinking about the role of funders and how we can kind of play a part in the bigger picture.